This is a scanogram of a 2-month-old baby who presented with enlarging head. Now please observe thinned calvarium and upward displacement of the vertex here, patent fontanelle. Now I will show you his CT scan. I'm sorry, there is a slight movement blur. There is moderate dilatation of intracerebral CSF species. Now these are the frontal horns of the lateral ventricles. This is the third ventricle. It is also dilated. Both foramina of Monro, they are dilated. I scroll it up to the vertex. Now please observe that there is dilatation of the extracerebral CSF species, but this is quite disproportionate as compared to the moderate dilatation of intracerebral CSF species. So there is obstructive hydrocephalus, but at the same time there is an element of the mild cerebral atrophy as well. Please observe that here the brain parenchyma has left the fox cerebri and the gyri are thinned. So it is not a communicating hydrocephalus. There is an element of mild cerebral atrophy as well. Now please observe that here this is the upper part of vermis. It is visible. Low down vermis is not visible. Both cerebral hemispheres, they are relatively smaller in size, and fourth ventricle is communicating with the dilated cisterna magna. So, and the posterior cranial fossa is not enlarged. So it's a case of Dandy-Walker variant as well. Now I will show you. This is the coronal scan. Please observe disproportionate dilatation of the lateral ventricles as compared to the extracerebral CSF species and thinning of the gyri. So there is moderate hydrocephalus, but with a relatively disproportionate dilatation of the intracerebral CSF species, but at the same time there is mild cerebral atrophy as well. This is the place here where dilated fourth ventricle is communicating with the dilated cisterna magna.